Root canals are a common dental procedure that is often misunderstood and feared by many people. In this video, we will walk you through the procedure for getting a root canal, from the initial diagnosis to the final restoration. What is a root canal? A root canal is a procedure used to treat an infected or damaged tooth. The inner pulp of the tooth, which contains the nerves and blood vessels, becomes infected or inflamed due to decay, trauma, or other issues. During a root canal, the infected pulp is removed, the inside of the tooth is cleaned and disinfected, and the tooth is sealed with a filling or crown. Signs that you may need a root canal. There are several signs that may indicate you need a root canal, including severe toothache, especially when chewing or applying pressure, sensitivity to hot or cold temperatures, swollen or tender gums, darkening or discoloration of the tooth, pimple on the gums. If you are experiencing any of these symptoms, it is important to see your dentist as soon as possible for an evaluation. The procedure. The first step in getting a root canal is to have a consultation with your dentist. During this visit, your dentist will examine your tooth, take x-rays, and determine if a root canal is necessary. If a root canal is recommended, your dentist will schedule a separate appointment for the procedure. On the day of the root canal, your dentist will numb the area around the tooth with a local anesthetic to ensure you are comfortable during the procedure. Once the tooth is numb, your dentist will create a small opening in the crown of the tooth to access the pulp chamber. Next, your dentist will use special tools to remove the infected pulp from the tooth. The inside of the tooth will be cleaned and shaped to prepare it for the filling material. Once the tooth is cleaned and disinfected, your dentist will fill the canals with a rubber-like material called gutta percha to seal them off and prevent further infection. After the canals are filled, your dentist will place a temporary filling or crown on the tooth to protect it until a permanent restoration can be placed. In some cases, a follow-up appointment may be needed to complete the root canal treatment. Following the root canal procedure, it is normal to experience some discomfort or sensitivity in the treated tooth. This can usually be managed with over-the-counter pain medication and should improve within a few days. It is important to follow any post-operative instructions provided by your dentist to ensure proper healing. Restoration. After the root canal is completed, a permanent restoration such as a crown or filling will be placed on the tooth to protect it and restore its function. This restoration may be done at the same appointment as the root canal or at a separate visit, depending on the complexity of the case. The final restoration will be custom-made to fit your tooth and match the color of your natural teeth. Once the restoration is in place, your tooth will look and function like any other tooth in your mouth. Getting a root canal may seem intimidating, but it is a common and routine procedure that can save a tooth and relieve pain. If you are experiencing symptoms that may indicate you need a root canal, don't hesitate to see your dentist for an evaluation. With modern techniques and materials, root canals are now more comfortable and efficient than ever before. Take care of your oral health and don't let fear stand in the way of getting the treatment you need.